And we are now live for the first live of 2022. And we're just telling everyone, and hopefully Dr. John will join in a second. This is his first live. Hello. Thank you for joining my first live of 2022. Oh, there we go. He's here. And now he just has to click on request to join. Request to join. Let's see what happens. So John is a plastic surgeon. Oh, here we go. I'm going to view the request. There we go. So you should be joining. I hope your Wi-Fi is good. I think he's in Athens. But let's see. Oh, there you are. Yes, you did it.
Experience.
Hi. You know what? I cannot pronounce your surname. I've been trying all day today. Anastasatos?
You did a great job. Thank you.
That can't be right. Well, nice to meet you, John. We've never talked before, but we've had some communication, obviously, through DM. So we're just going to, people have joined, which is great. So I'm in London and you're in Athens.
I am in Athens now, yes.
Cool. And how long are you going to be in Athens for?
I'll be here until, for another 3 weeks.
Oh.
Then I go back to Beverly Hills for about a month and a half, and then I'll be back in Athens for a month and a half.
Right. Okay. So your schedule is kind of like mine. So I'm going to say John, because I'm not going to say your surname. So John is a plastic surgeon, and you work in both Beverly Hills as well as in Athens, and you are Greek. Well, I think by your last name. Yeah, okay, good. I got that far. And you have quite an extensive resume. So you did your medical degree at Brown. So you lived in Providence for a long time.
Yes, right. And I understand you just visited my old neighborhood.
I did.
You were in Boston. When I was in college, I used to go to hang out in Boston because it was the cooler city compared to Providence. But definitely. Yes, I did undergraduate in medical school at Brown, and those were some of the best years of my life. And then I went on to Columbia in New York, and I did my surgical training in general and plastic surgery.
Yes, you have quite an extensive resume here. So like you've worked in lots of different places. You've done lots of different types of plastic surgery, like upper extremity microsurgery fellowship. So you've done a lot of stuff. So you have a lot of experience. And now you've been in private practice in Beverly Hills since 2005. So that's 16 years. That's a long time. So you split your time between Athens and Beverly Hills?
So this is a recent thing.
Oh, okay.
It's something I started the last 2 years.
Okay.
A lot of it has to do with the fact that I have strong ties to Athens, and I wanted to spend more time here. But also, and I'm sure you can relate, once we tackle one goal or task in our lives, we feel a niche, perhaps, to create something new and different.
Yeah.
So I am very happy with what I've created in Beverly Hills. I have a clinic that is unique in the sense that it offers the whole spectrum of plastic surgery procedures.
Right.
And I aspire to do the same thing in Athens and draw people from different parts of the world, like I do in Beverly Hills.
Cool. All right. So I do something similar, obviously. Well, sort of, not really. Sort of similar. So I split my time fairly equally now between Dubai and London. Very different than Beverly Hills and Athens. So I'm sure they're very similar too. So I've never been to Beverly Hills, but I do watch a lot of television. Well, a fair amount of California-based TV shows. So I've seen some stuff going on there. But okay, cool. So you have so your website is losangelesplasticsurgery.com, which is quite an easy one to remember, guys. So if you want to check out his website, losangelesplasticsurgery.com. And the reason why we kind of decided to do a live is because you sent me a really nice DM, and I actually have that here. So John and I have similar views apparently about how we feel that plastic surgeons and dermatologists are kind of selling skincare or talking about skincare on Instagram and kind of doing a lot of paid promotions. And I think you kind of feel the same way that I do about skincare in general, that most of it is similar and just the price points are varied. And so you sent me a really lovely message about that, saying, you know, thank you for kind of helping to educate the community in this way. So I was like, oh, that's so cool. We have similar viewpoints. So I like to do lives with people who I can learn something from, but also that we share a similar viewpoint. Though it's always good to have debates too, which, you know, I'm not adverse to. So what I wanted to start by asking you is some questions that I get from patients that are plastic surgery questions about facelifts and things, which I'm not very good at answering because I'm not a plastic surgeon, as everyone knows. So, and I know you have a special technique of doing facelifts, right? Because you sent me some of those pictures.
I do.
Yeah. So can you tell us, just kind of in layman's terms, what anatomically causes the skin to sag? Because people come to me thinking I can lift their skin with a cream or a thread or something. But I'm always like, no, 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 it's not just your skin that's sagging, it's the entire structure. And it's hard for me to explain that because I've never done a facelift, so I can't really visualize it very well. So can you explain how you do a facelift even, or what makes it sag?
Thank you for asking me this question, and I get the same questions too. And thank you for starting with that introduction, because you're absolutely right. It's not necessarily the skin that sags, or it's not the only thing that sags or stretches, but the substrate. The substrate on the skin, where the skin sits to keep it, you know, simply and plainly. And that is all the soft tissues that exist underneath our skin, which is a combination of different fats and different fibers and muscles. So they stretch with time, they elongate, they sag, and cumulatively, we see certain changes. In particular, there are 5 changes that we see on the face that really start in our early 30s, perhaps a little bit earlier, perhaps a little bit later, for both men and women. But essentially, it is loss of cheek fullness.
Okay.
It is the deepening of the nasolabial folds and the elongation of the nasolabial folds. It is the increase of the distance between the lower eyelid margin and the top of the cheek. Correct. So and the creation of the tear trough. I'm sure you get many requests to put filler in there in order to camouflage that. The corner of the mouth goes south. And the most prominent and the most awesome and the biggest reason why people come to see me for a facelift, and usually they don't like the idea of a facelift, is when they see jowls. The jowls that ruin our jawline. Yeah. So, you know, the skin gets pulled as those deeper structures follow gravity, stretch, however you want to describe it. And the same thing happens with the neck. Most people feel that a neck lift is a simple thing as pulling the skin, but it's not, because it's the muscles underneath the neck, the platysma muscles, that relax and stretch. They're responsible for the neck bands that many people have. And in order to treat the skin, you have to treat the underlying muscle, and then you apply the skin over it, and it looks nice and smooth.
Right. Yeah. So it's not just the skin that is the problem. So, like, for example, someone just asked if you have health problems and you don't want to have a facelift, because a facelift requires general anesthetic generally, right? You wouldn't do it under sedation.
That's an amazing question. We can do facelifts under local anesthesia, and it's actually safer, and it's an easier recovery because patients don't have the nausea that comes as a result of having general anesthesia. But it's possible, and people can have the exact facelift under local anesthesia, and I offer it to some patients that are afraid about going under. But
they're not awake. You sedate them anyway, right?
I don't sedate them. It's just oral sedation, just a little bit of Xanax.
Oh my God. So the patients are awake.
Yeah,
You're
you actually, it's less awesome than what you think or imagine. But yes, just oral sedation. It all has to do with injecting the local anesthetic very carefully, very smoothly, painlessly, and then the face is numb. They don't feel anything.
but do you do nerve blocks then to just block the whole area?
Block the whole thing. Yeah.
Oh my, I mean, I do Mohs surgery
Actually,
for
this is
skin
one of
cancer,
the most
but
recent innovations in,
right.
in facelifting surgery.
That's
But
wild.
I'll
So
be
guys, if,
honest with you because you like
yeah,
always being honest.
yeah,
The reason why you don't hear that a lot, it's because it's very time consuming on the plastic surgeon doing it. It takes a lot more time to do this critical step of injecting the local anesthetic in a certain way that's comfortable for the patient. And it also requires different skill sets
mm,
that many could have, but they're not motivated to have. And I'm
yeah.
talking at the level of the physician.
So, so someone just asked, do you put adrenaline in the anesthetic? I would imagine you would not because you're doing nerve blocks. So you don't use adrenaline, right?
We do, but it's a very
Oh,
diluted amount of adrenaline.
oh, okay. So, wowzers. So, but how long does that take? Like, how long is the surgery? If we're like, I don't know. I wouldn't even be able to say. How long does it take to do the whole surgery?
A typical, a typical facelift and neck lift is not one or two operations. It's really a combination of doing multiple things to rejuvenate the face and neck at the same time. So
Right.
everybody's a little bit different, but on average, I would say about 4 to 5 hours.
So one surgery is 4 to 5 hours.
Correct.
So the patient's, so you can talk to the patient throughout the surgery,
Yes,
basically.
you know, frankly, most patients take a nap during this whole procedure.
Yeah,
But
that's,
if some patients are awake, it's actually fun because they can talk and I can talk back to them at the same time. It sounds like science fiction, but it's very doable, and you know very well that it's safer to do any operation under local anesthesia as opposed to general.
yeah, no, and patients definitely would prefer that, even though it sounds horrible. I think generally patients prefer not to go under. A lot of people have fear of, general anesthetic and so on. So no, that's really interesting. Gosh, oh, that's a lot of anesthetic. But no, being able to inject painlessly is a real skill that needs to be kind of trained. Need to learn to do that. So I like to think that I can inject. Well, there's some people who are watching this who have had me inject them. I'm generally quite light-handed with my injections, but it does take I mean, I do a lot of injecting of stuff, so it does take a long time to learn that. So, right, that's really interesting. So you can do it with patients awake. So that was what a lady asked. That's okay. Wow. No, that's a whole new concept. But then, so you make the incisions, and then you basically undermine and then lift. And I'm sure it's much more technical than that, but that's the basic idea, right?
So the principles are actually simple. It's exactly what you described. It's undermining. All the better facelift surgeons in the world who specialize in this technique, because as you know, there are not many plastic surgeons around the world who do facelifts. The
Mm,
anatomy is simply more challenging and complicated. So people who do it, they must be comfortable and quite averse. But the principles are to lift those structures and to put them back where they used to belong at a youthful age.
right.
So, and then we redrape the skin over it. So in this day and age, good facelifts do not rely on pulling or tightening skin because
Right.
that doesn't work. And
Right.
many people still do them like that, but the skin stretches after a year or two, and it's not effective.
Right, so that leads on to another question I get a lot. How long do the results of a facelift last?
It's been studied extensively, and the number is about 10 years. So a
Right,
facelift will actually give you 10 years of youthfulness.
right,
And of course, we cannot stop aging, but
right.
the result actually lasts more than 10 years, lasts for the rest of the life of that person. Because if somebody gets a facelift at 55, they're going to look, quite younger. But when that person becomes 70, they're not going to look 70. They're going to look much younger at the same
Yes,
time.
that's interesting. That's a question I get a lot from patients who get Botox or Botox really. They say if they stop doing Botox in 10 years, will they look like 10 years? Will they revert to what they look like with wrinkles 10 years ago? Or will they look 10 years older? Do you know what I mean? And I'm always like, no, you're going to look like you would have done 10 years ago at the start of your Botox, because you won't have developed more wrinkle, because you'll have stopped developing the wrinkles. So it's the same concept, isn't it? That you kind of
Yes.
stop time almost. Sort
Yes.
of. Yeah. So yeah, so that's a question I get a lot. How long does it last? So okay. So then if you had a facelift at 55 and then you started seeing a little bit of sagging happening around 65, 68, would you then go and have a second facelift, or would you just, I guess it depends on the patient if they wanted to do it again. Does that make sense?
So, great question. Thank you. And that's a typical case. What you just described is very common. And the reason is that to lift the deeper structures of the face to begin with the first facelift, and secure them tightly and make sure they don't come down again or they don't descend again, is the art of doing a good facelift. When that happens, people come and ask for a second procedure. But their requirements are different in the sense that they don't need to have skin removal at that point, because the skin was removed with the first facelift. And if they do, it's very minimal skin that needs to be removed or tightened. The whole process is to lift all those muscles and fats that have descended again and put them back where they used to belong years before.
Right. Okay. So then someone just asked a good question. I mean, what do you think about the alternatives to facelifts? Because everyone's always looking for the kind of the easy fix or the less kind of invasive fix, like HIFU or threads. I mean, what are your opinions on, well, they're very different, HIFU and threads, high frequency.
So, one of my favorite things to share with my patients and my friends is that there are no shortcuts to success in life and in plastic surgery.
Or in plastic surgery.
So I'm sure you would appreciate that. And, if you want a certain look and to look a certain way, aesthetic medicine is still medicine. And that's something that people do not appreciate. Like, if you need to have your gallbladder taken out, there are not many other things that you can do. You need to go to a good surgeon who does a good job at that and take care of it with the most sophisticated technology that is available. And I explain the same thing to my patients, that there are certain changes on the face because there are anatomic changes that happen over time. And the best treatment will come if you address them at the root of the problem. Now, for a variety of reasons, I understand that people are fearful of facelifts. They may not have the downtime. Anything on the face is more scary. Let's be honest, that is true. So, are there alternatives? Obviously, fillers work well. There are some tightening technologies like Body Tight and Face Tight and J Plasma that may or may not have a positive outcome on patients. Everybody responds differently, so I discussed that with them. But still, that affects the skin and not the deeper structures, like we discussed at the beginning. So there may be some skin tightening, which obviously any improvement would be a good improvement. When it comes to threads, the way I present it to my patients is that, at least in the United States, we only have the threads that are absorbed. I know that in Europe, that process has been going on for many, many years.
Yeah.
And there are different threads. Some of them are semi-permanent, some of them are permanent.
Mm.
In general, whatever relies on pulling skin, I see it with apprehension, and I always share it with people.
Mm-hmm.
I believe threads, when they're applied, they cause some swelling that people like because they like that full look.
Mm-hmm.
But when it goes away after 6 months or so, and they go back to where they started, they may be a little bit dismayed. But at the same time, I think people treat it as a cosmetic treatment.
Yeah.
It's like going to the spa and getting something that's going to last you for a few months. So I think the threads are effective because people have been doing them for decades. So you can't argue with success. Obviously, there is a reason why people do them. But I
Mm-hmm.
think a lot of the reason is mental and psychological. It gives people a sense of well-being.
Yeah, absolutely. Like they're doing something good for their skin or for their face, that doesn't feel too scary, even though to me threads are pretty scary. So just the barbed wire appearance and how they are put into the skin. But yeah, I think yeah, as kind of a temporary thing, it makes people feel good. So I think there's a very strong placebo effect of most of these treatments as well. It's interesting because even though a facelift has come so far, kind of in at least from my point of view, in how it's done and the kind of the results that are you get now than maybe 30 years ago when it was maybe perhaps not done as I don't know done as well. At least that's kind of the impression I get. People are still so fearful of plastic surgery, and they go to a dermatologist like me to find like a quick fix rather than going to see a surgeon. And I'm like, I think you really need to see a plastic surgeon. And I try to help my patients not be fearful of plastic surgery, though to be fair, I've never had a facelift myself. So I don't speak from personal experience, but no, I do find that people are very fearful of it. One question I get, actually I've had a lot in the past few months. I've had a couple patients or a few patients who've gone to have rhinoplasties or facelifts, and they've been getting skin treatment from me with topical retinoids, and their plastic surgeons have told them to stop using their tretinoin like a week before. I mean, do you tell your patients to stop using topical retinoids before surgery? Silence.
In particular, the retinoic acid doesn't bother me. I don't tell them to stop that.
Right. Okay.
And there have been studies actually where plastic surgeons would do facelifts and actually treat that elevated skin with chemical peels, and even that was a safe thing to do. So topical retinoids don't cause any reason for concern to me.
Yeah, they don't cause any wound healing, because the only thing I could think of is, do they cause wound healing problems? Is that the issue? I always tell my patients to go back and just do whatever their surgeon tells them to do, because they're the one who's responsible for the end result. But I always kind of also say, I don't see why you would need to stop using your tretinoin or your hydroquinone, because
I
I,
agree.
yeah, I mean, I've seen plastic surgeons do CO2 resurfacing at the same time as a facelift, and so if you can do that when you're doing a facelift, then surely topical retinoids are not an issue. But yeah, that's a good one. So that's a question I get a lot as well. Same with rhino. I had a patient actually just the other day. She's getting an open rhinoplasty, and the surgeon told her to stop using her tretinoin like a week before. And I was just baffled as to why that would be, but I told her to do it anyway, to stop using it. So, and what, now you don't do a lot of filler and Botox, because you told me you obviously you do mainly actual surgery. But what do you, I mean, how do you approach kind of, if someone comes to you and says, I want nasolabial fold filler, when they really should have a facelift? Do you do the filler first and let them kind of sit with that for a while, or do you not bother?
I discuss all the options that I can offer them. So
Okay.
I can offer them the surgical options and I can offer them the non-surgical options. And there's no right or wrong answer for everyone. I feel my patients. If they have apprehension for surgical things, I don't discuss them too extensively. I discuss the non-surgical things.
Okay.
And typically, when somebody hasn't had any facial rejuvenation treatments before, I do believe the fillers and Botox are great to start with
Mhm.
because, the results are almost instantaneous, and people are very happy. And like I tell my patients, especially with the fillers, if you do them right, you actually, next time you come to do it, you build on the previous treatment.
Yeah.
So I do believe that there is a significant place for them in aesthetic medicine, and especially because they can have an additive effect, and over time you can offer someone major transformations just with those treatments.
Okay. Do you do Sculptra? Because we've had a lot of questions about that come through. I've
I do.
never, I don't do because I don't know anything about permanent filler. I mean, it's not a permanent filler. How would you describe it as a permanent filler? How would you describe Sculptra to everyone?
It is. A component
It,
of it is permanent.
it's permanent.
So,
Okay.
so out of all facial fillers, Sculptra used to be popular in
Hmm.
Los Angeles, but it's not lately. But now there has been a renewed interest in Sculptra
Okay.
because one of the more popular operations in plastic surgery these days is what's called the Brazilian buttock lift.
Oh yeah.
And and people, because some of them don't have enough fat simply
Okay.
to harvest and put there, we're doing it with Sculptra.
Right.
So
Okay.
that's why Sculptra mainly has come back into use, at least in my practice. Not so much for the face. It's a great filler for the face, but you have to do it in 3 stages to see the full effect. So
Mhm.
a patient comes, gets a treatment this week, and then they come back and get another treatment, after 4 to 6 weeks.
Right.
And it's after the second treatment that you start to see the effects of it, and the third. So, in this day and age, we have so many great fillers, and all of them are instant and offer instant results. And understandably, people don't want to do 2, 3 steps when
Yeah.
they can have one step.
Right. Okay. Okay. So how much
But
filler
where I
do you have to?
use it,
Yeah. Yeah. What do you? Where do you use it?
what I use it mostly for, Sculptra, is for those people who want to have gluteal and hip augmentation.
Right.
And Sculptra is very well used for that.
But how much do you have to use to do a hip or butt augmentation? I mean, you must have to use like 10 mils or something.
You read my mind. I use a minimum of 20 syringes each time.
Each time. So you have to do it. So I don't know anything about these butt augmentation surgeries, but do you have to do it like in stages as well? It's like do you do it slow, like every 3 weeks or something?
So
Wow.
somebody would come in and have the 20 syringes at one time, and then you would let that heal and settle. And then if they want to come back to get a second one and a third one, it's the same process.
So, okay, are they awake for this
Yeah,
procedure?
that's actually done under local anesthesia. So that's an advantage of it.
Wow. I don't know anything about that, but that's such an interesting okay. Okay, fine. So that's like a permanent like butt filler. It's interesting. Someone's asked, if you have Sculptra in your face, does it affect your ability to have a facelift later on? Like, can you not have a facelift later because it's like putting cement in your face? That's what someone
Yeah,
wrote.
again, great question. Thank you. So many times I open up faces and it's very hard to dissect the skin because there's a lot of scar tissue there. And
Yeah.
actually, that is more frequently because of threads.
Yeah.
Threads cause a lot of scar tissue under the skin, and that's why you said perhaps that they scare you.
Mm. Yeah.
And to a second degree, fillers. But Sculptra is not necessarily, doesn't increase the difficulty factor when one does a facelift,
Okay.
but um, other products that cause more inflammation, like the threads do,
Mhm.
that can make the procedure more challenging, but that only means that it takes a little bit more time.
Okay. And is there one thing that I do get patients asking me is, I have a lot of patients who take isotretinoin, so Accutane. Can you get a facelift or have plastic surgery while you're on Accutane? Do you have any thoughts about that?
Accutane?
Yeah, Accutane.
Yes,
Like,
there's no contraindication
conjugate.
to stop Accutane.
Okay.
Obviously, what I would do in those patients is with their preoperative workup, I would just check their liver function tests.
Yeah.
But beyond that, there's no contraindication.
Okay. And the other question I get a lot too is, what is the right age to consider having a facelift?
It's whenever
Sure.
you see things that bother you. I mean, there's no right or wrong age. I
There
have
is no.
done the youngest facelift actually in a British lady. She was 34,
Oh.
but her main reason for doing it was because she had jowls. It was hereditary.
Mhm.
And that was the only way to fix jowls. And that is the only way to fix jowls
It
effectively
is.
is by doing a facelift.
Yeah, it is the only way to fix jowls because I have so many women come to me and say, "Can you fix this?" And they look at their, they're looking at their jowls basically and saying, "I want." Everyone looks better when they go like this, when they tighten their face like this, and they always want this corrected. I'm like, "Yeah, I'm the wrong, I'm the wrong person for you, because I can't. Nothing I do because they say, "Oh, can't you put filler in here to correct the jowls?" I'm like, "No, I can't put filler. That's going to add volume to somewhere where you already have a volume problem." And heaviness where there is a heaviness problem. So that's not going to work. And I don't know why there is that kind of misunderstanding, which I see a lot. I don't know if it's a social media thing that because of some of the videos that you see on social media where they put filler in the jawline and then suddenly everything looks tighter. I think that may be confusing people as to what needles can do and what surgery can do. I mean, do you have that problem? People come and say, "Can you put filler here to fix my jowls?"
Absolutely.
Yeah.
It's a very common request, and I address it the same way as you do.
Right, yeah. So it's like, no, you have to see someone else. But it's interesting too how every woman will pull their face like this, and but everyone looks better when they do this, like everybody. So I don't think I need a facelift quite yet. Well, maybe I do, but when I think I look better when I tighten my skin here. I mean, I had lunch with a plastic surgeon colleague of mine in Dubai, and my friend asked her, who's not a doctor, not a surgeon, what she would do to me. And I would never ask a plastic surgeon that. So I would never, because I don't want to know what you think you could do for me. I don't want to know. And she told me I needed liposuction under my chin. So I think she was being really nice, but she said that. So maybe, I'm 40, but I still don't think I need facial surgery. But the amount of women who come to me and do this is just incredible. And they think that they can get a jawline like here from putting in filler, but which is also so confusing. One question I had written down for you was, how do you manage patients' expectations when it comes to cosmetic surgery? Because people must come to you with really crazy kind of expectations of what you can achieve with their faces. I mean, yeah, there's a big one.
So, patient expectations and patient management is different for me in Beverly Hills than it
Right.
is in. So,
Okay, that's interesting. Oh, we've lost your audio.
when they come to my office, they
Mhm.
they've thought about it. They've done a lot of research. They've seen other consultations. They've seen before and after results. And if they like our conversation and if they like how they feel about me and if I like how I feel about them, then we proceed. And it's there's not a lot of anxiety, let's say.
Mm-hmm. Mm-hmm.
Patients in the US, they're not afraid to get plastic surgery. They're not afraid to go under general anesthesia. As a matter of fact, they always ask me what more they can do. They frequently want to combine operations and, for example, do face, nose, breast, abdomen at the same time. It's not an exaggeration.
Wow.
So there's not that fear that I see that exists in other parts of the world, in other cultures. The other thing is that in Los Angeles, the level of plastic surgery in general is very good. And the patients do have very high expectations. Let me give you a very specific example since we talked about facelifts and faces. An American woman who is 50, if she comes to get a facelift, she wants to look 40 and under. And if she doesn't, she's going to be pissed off. It doesn't mean that bad work was done, but culturally and mentality-wise, that's what they want. I would say that in the US, people are more concerned with aging. It affects them more, as opposed to Europeans who are much more comfortable with aging and the process of aging. So the facelifts that I get requested from people in Greece or Europe are lesser. They are, what they ask for me is, I want to look a fresher me. That's exactly the same phrase that I get every time. But a fresher me is not enough for an American lady coming to get a facelift. That's why our operations there, when it are more aggressive and more aggressive, let's say, than operations in other parts of the world, like Europe.
Right. That's really interesting. Because the thing is, in Dubai, most of my patients are European. So I get the general sense that like European women are, I would say, more conservative with what they think is age related. They're more happy with getting older, if you will, like looking older. So I find, especially British women, as opposed to, but I also see it different in different cultures. I have a cohort of like French patients. I have a cohort of Scandinavian patients, Italian. Because in Dubai, it's so multicultural that the British patients on the whole are much more conservative and more happy to just age gracefully. And they just want a little bit of Botox, and they still want some movement and a little bit of filler, just a little bit, you know, just to give a little shape to the upper lip, and that's it. While like a French woman, I generally find they're a little more into having a little more Botox. But this is a huge generalization. So obviously not all French women are like that. But I, with Americans, I don't have that much experience because I've never worked in the United States as a doctor. So I can imagine though that the expectation is much higher because the general, how women view their aging in the United States is different from definitely from Europe. I do see that, but not from a clinical perspective. So that's really interesting, actually.
I'll give you another example. Speaking of threads, threads are not popular in the US.
No,
For most people, threads is a joke. They don't do anything in the United States.
Yeah.
For them, it's nothing.
They're quite popular in the United Kingdom.
But obviously, yes, but obviously in Europe and Asia and everywhere else, they're very popular because people are satisfied with those little changes. But in the US, they're not satisfied with those little changes.
So what someone has asked is, one thing is, can you get a facelift when you're pregnant? I would imagine the answer is no. You wouldn't operate on a pregnant woman for cosmetic reasons.
Well, there are other priorities when somebody's pregnant.
Yeah, exactly. The answer to that person's asked that a couple of times. The answer is no, we generally don't for pregnant women. Yeah, generally not. And the other question—
I would not do a facelift in a pregnant lady.
No, definitely not. Good. Yeah, we agree on that one. The other question is, how do you choose a plastic surgeon? Yeah, good question. I don't know. How do you? You follow them on Instagram. That's what you do.
Well, thank you. A lot of the things we do in life are perception, right? Are
Yeah,
based on feeling. They're not necessarily based on logic.
yeah.
So how different people choose, I don't know, but I can tell you that in my practice, how I want them to choose me is and move forward is only if they feel comfortable.
Mm.
And if their heart tells them it's a go, then it's a go.
Yeah.
Because in reality, patients don't know how good surgeons are. They don't know the difference between excellent, very good, or good. Many
Mm.
people can, deliver some basic results, but they're not in the operating room to judge how someone operates and what they're capable of. So pictures do help because they do give people an idea, and I find it very useful in my practice because sometimes they will see something that I've done that they would like,
Mm.
and it serves as the point of initial discussion.
Mm.
But at the end of the day, what I share with my patients is that the successful result in plastic surgery is not only objective, but it's subjective. Subjective in the sense that every person has a vision in their mind of what exactly they want to look like.
Mm.
And everybody does that
Yeah.
because they think about it for years before they do it. They save their money for years before they do it. So I feel I will do my job best if I investigate that vision, if we discuss it, and if I can tell them that, yes, I can give you what you want, or I can give you something close to what you want, or what you want may not be possible or realistic, or it could be risky for you. And once you go there and and you talk about that, then that opens up many opportunities for those patients because you give them options and you allow them to make the right choice for them.
Mm.
But, when I first started in Beverly Hills, I had a lot of younger models who were my patients coming for breast augmentations. And I would ask them, how do you want them to look like? And everybody said the same thing. I want them to look natural. All right.
Yeah.
So uh, every now and then, I would have somebody who had a good outcome, but she wasn't necessarily very happy. And the reason is because what was natural to her was something entirely different than what was natural to other people. So when I started asking, tell me what's natural to you, I was starting to get different answers. Some of them were not natural at all. But if I know it, I can give it to them, and
Yeah.
that's what makes people happy. So again, we have some objective standards of beauty, but if you think about it, a lot of the things we do are subjective.
Mhm.
Speaking of BBLs, Brazilian buttock lifts, when I was training, it was something we read in plastic surgery books. It wasn't popular. People were not doing it. But now people are doing it. I think it's a fad that will go away after some years. And
Mhm.
patients will come and want to have that fat removed from those areas because buttocks sag too and fat, descends.
Yeah.
So it's one of those things.
Yeah, totally. Oh gosh. But you can't, can you remove Sculptra once it's there? You can't, can
You
you?
can't, no.
So that they're stuck with
You
their
can,
butt.
correct, correct.
See, that's kind of scary. But if you used fat transfer, then yeah, that you could, I guess you could liposucked it out again.
Yes.
Yeah.
Now, sometimes if we have Sculptra or some other filler, that actually can respond moderately well to liposuction. I'll tell you the biggest, the most popular filler for butt augmentations is illegal in most parts of the world. It's called PMMA,
Oh yeah. Yeah.
polymethyl methacrylate. Extremely popular in South American countries. A big black market in the United States for that. People take enormous risks to go to random people injecting them. And that is actually the most difficult filler to remove from the buttocks, but it does respond to liposuction as well.
Wow. Wow. So would you have to visualize it to be able to know where it is? Like with, no, you would just, you can see it where
Yeah,
it
you
is.
feel it.
You can
It
feel it.
gives a spongy, you
Does
feel
it?
it. Yeah.
Like a sponge.
Yes.
Oh my gosh. Someone's
Yes.
asked, can you correct a bad facelift? I guess a bad facelift would be if it was too tight. Would that be a bad facelift? I mean, it depends what you call a bad facelift, right?
Yes, it's a rather vague thing, but let's
Mm-hmm.
assume that a bad facelift is a very tight and full facelift.
Mm-hmm.
Sadly, there's not much you can do to that. You elevate the skin. You really can't rearrange it. You can't pull it anymore. I had a patient like that recently, and there wasn't anything I can do for her. So you just have to give it a few years so it stretches and relaxes, and then at that time act on it.
Okay. And is there one key question you think every patient should ask a surgeon to kind of decide whether that person is the right surgeon for them, or like someone asked that question?
Well,
A hard one.
for, there have to be some basics.
Mm.
So a person has to choose somebody who's a trained professional in this.
Yeah.
So I just told you I practice in Beverly Hills, which is in Southern California.
Mm.
I will give you this statistic, which is an official statistic. 80%, 70 or 80% of cosmetic plastic surgery in Southern California is done by non-board certified plastic surgeons.
What, how
So
many? 70,
there can
70%?
be there can be an internist. Yes, yes.
Oh my
So
God.
there can be an internist doing liposuction, and there can be a gynecologist doing liposuction.
Yeah.
There can be whoever doing whatever. Because in the United States, the law permits you, if you have an MD, a medical degree, and you pass the certain state licenses where you practice, you can do whatever you want in your office. And people are doing it. So I can't necessarily blame the patients who go to someone's office. It says John Smith here, cosmetic, whatever, and there's a bunch of diplomas on the wall. They don't know what those mean.
Yeah, totally.
And the people here, and a lot of people will tell people what they want to hear. They'll try to sell them on things, and there isn't anything, therefore, in particular that patients have to ask. But if they ask the right questions, are you board certified in your specialty? Where did you train in plastic surgery? Who trained you? Very rarely patients ask me these questions, by the way. I don't know if it's because they know the answer already or because they don't care. But that's one thing that I don't like about cosmetic medicine, how commercial it has become.
Yeah.
And many practitioners all over the world treat it commercially and not as medicine first.
Yeah,
But
absolutely. Yeah.
I
No.
believe all good, medical practitioners and physicians anywhere in the world who love what they do and they practice consciously and ethically, I believe they give off that vibe, and I
Yeah.
believe patients can feel that. And I think at the end of the day, that's how patients decide.
Yeah, no, absolutely. It's like the relationship you get or the vibe you get from the doctor you're seeing. But just that you have medical licenses in 3 states and in Greece. So that means, are you board? Because you have to be board certified in every state in the United States, don't you? It's a different exam per state, right?
So yes, I'm licensed in California, Alabama, New York,
And in
and
Greece.
in Greece. So to become board certified in the United States in plastic surgery, after you finish your training and you start working, then you take oral and written exams
Yeah.
after 2 years. And if you pass, it's kind of the feather in your cap. I can tell you that the fail rate every year is 25%. It's pretty high. So many plastic surgeons never become really board certified.
So you want to, so the key thing in the
Again,
United
in the
States,
US, I don't know how it is.
oh no, I said, because in the US, you guys have board certification. In the UK, we do it's called post CCT or becoming a consultant. So when you say board certified, we say consultant. It's the same thing. But yeah, sorry, go ahead. You're saying? I think there's a
But in the
delay.
US, again, the law permits many different specialties to practice whatever type of medicine they want. So um, because plastic surgery is more lucrative, many other doctors who never treat in plastic surgery, dermatology, or anything close to that, they engage in those treatments and procedures. I don't know how they do it, but so they certainly don't have the foundation to treat patients, especially when those patients have complications.
Yeah, then that's the main differentiator too. It's being able to deal with complications. I do a fair amount of corrective stuff for other people's patients. So I'm sure you do as well. And that's part of being board certified, is that we learn to deal with problems. So that's part of our training, is that we basically are, I always feel like I'm like kind of the dermatology firefighter. So when someone else gets mismanaged somewhere else, I have to go and fix the mistake that was made, whether it's with rashes, treatment of rashes, or you know, Botox and filler complications. Speaking of filler complications, someone keeps asking about, is it safe to dissolve filler? It is safe to dissolve filler, but you can only dissolve filler that's dissolvable. So I only use hyaluronic acid filler. So I use hyaluronidase to dissolve it, and it is safe to dissolve it. It can be a little bit painful, but it should just dissolve the filler, and that's it. But it is safe to do. So, but you can't dissolve something like Sculptra is a permanent type filler, and there is no dissolving agent for that. Someone's asking, would plastic surgery be an option for those with hypertrophic or keloid tendencies? Oh, I get this question a lot as well. Can I have a facelift if I'm prone to keloid scars? You can answer.
That's a great question.
Okay.
Even people who keloid, they don't respond the same way above the neck.
Yeah.
So the face and the neck heal better when it comes to scars than the rest of the body.
Yeah.
We really don't know why to this date it happens. We believe as surgeons that because the face and the neck have better and more abundant blood supply, but that's why facelift scars heal well. That's why eyelid scars heal well. That's why even thyroid surgeons who remove thyroids, if they do a good closure at the neck, it's going to be an almost imperceptible scar. So even people who tend to form keloids, they may not form keloids if they have facial plastic surgery.
Okay.
And there's another secret that I can share with you, is that patients who are over 55, they heal better when it comes to scars than younger patients, because that's right up your alley. It's because they don't form as much scar tissue. We don't form as much scar tissue as we age. So less scar deposition in the wound means better scar.
Yes. Cool. No, absolutely. I was going to ask, do you have any, someone just asked, what are your kind of top tips for scar management post-surgery? Is there anything that you tell your patients to do or not to do? You know, because you put the scars here behind their ears, along their hairline. Once they have their stitches removed, what do you tell them to do generally?
It's a very frequent question. What what you can do to the scars to make them go away or make them heal better. Obviously, you cannot make a scar go away in an adult. That's only in embryos can do that, but not adults.
Yeah.
But there's a huge industry out there that promises that makes scars this and that, and I don't tell them to use anything. If I do tell them something, it's the only proven thing, and that is silicone.
Yeah.
Either silicone sheets applied on the wounds, but because they can be a little bit cumbersome to stay on the wound, I also tell them they can use 100% silicone gel. Beyond those two things, I don't recommend anything. And then the other question is the sun avoidance. It is a myth that people should avoid the sun because in many cases, the sun actually will make your wounds look better and nicer. I do tell everyone, no matter what, to wear sunscreen, every day. But even sun is not necessarily bad for wounds. It can be very good.
Yeah, cool. So someone keeps asking about the keloid scarring thing. So it's not an issue. You normally, because from the neck up, you don't tend to keloid. One question that someone keeps asking is, why is it called plastic surgery?
That's a very philosophical person asking that question.
Yeah.
So plastic actually comes from the Greek word plastikos, which means to mold.
Oh, it comes from the Greek word.
Plastic,
of course.
Plastic means it means something that can be molded or something that's moldable.
Cool. All right. Well, I think that's a good place to. Yeah. That's cool. No, that's a good place to. Cool. Well, we answered lots of questions, which is great. Thank you so much, John, for taking the time to do this. I hope you enjoy your last few weeks in. You're not working too hard.
It's a pleasure and a privilege. I appreciate you having me.
No problem. I hope that was helpful, guys. I'm going to save this to my feed so you can watch it on IGTV. And thank you all for joining us, and thank you all for asking questions. So good night, everyone. Have a great weekend. Thanks, John. Speak soon. Bye.